So communicating the results of radiological studies to patients, from high-tech to human touch imaging. Why is good communication between the patient and the doctor essential for proper patient care? Now, this is a definition about what the dialogue should look like and what the benefits might be. From EPF's perspective, and we've done a lot of work on patient empowerment, it fits into that broad framework on patient empowerment that has essentially 3 pillars. On the one hand, we're looking at quality information to patients and health literacy, so the patients can actually understand the information and help to navigate the care that he or she receives. The dialogue between the patient and the health professional, regardless of who that health professional is, ideally in a multidisciplinary team. And the third dimension is self-management. And that critical, quintessential communication and dialogue between the patient and the radiologist fits very much into that model. And from EPF's perspective, for us this work is very interesting as it evolves. We're looking at it as a model for working with other societies. It's quite pioneering. We're not working yet with other mainstream medical society, learned societies, and we're learning a lot from the relationship that we're building with the society and the potential there. And then we'll have a discussion on a driver diagram that we've worked on together, the committee working on audit and standards and our own patients advisory group, looking at a driver diagram for patient-centred care in clinical radiology, exploring that diagram and then looking at the kind of work that we need to take forward with regard to identifying indicators and taking it actually into the real-life, real-world situation and how we can best do that with maximum input and maximum results for everybody, the radiologists, the professionals, but also indeed the patients at the end of the day.
Ms. Bedlington, what is the current situation regarding communication between patients and physicians?
European Patients Forum is an umbrella organisation representing patients, and we're developing a very strong relationship with our opposite numbers, with the physicians organised at European level, the nurses, the pharmacists, the health managers, to focus specifically on that topic. And we've set up a coalition focusing on health literacy, how to improve information to patients, but health literacy, the health literacy needs of patients, the health literacy needs of medical professionals, and how to promote a shift from monologue to genuine dialogue, because we feel that that is essential to empower patients, enable them to really understand their own care and participate in their own care, which is clearly one of the ways to move towards a more progressive, quality-oriented health system, but also a more sustainable one at the end of the day.
What are the risks involved?
From our perspective, the risks are really minimal. I think one key element is the quality information that patients are seeking. Some people say that the internet presents a risk because patients are seeking information from a variety of sources, but with the right sort of health literacy skills, patients are able to understand and evaluate which information is really valuable information, which is perhaps less. I think one challenge that medical professionals have, of course, is time to really talk to patients, to give them the information in a way to answer questions, etc. And this is something that we need to reflect on and work on. But again, a patient that already has information before sitting down and talking to the health professional will be more able to engage in that dialogue. And I think the trust will also be there as well, which is absolutely key.
How can communication improve?
I think I've explained a little earlier in terms of what we're trying to do at European Union level. I think the medical professional community need perhaps to understand patients in a different way, to shift from thinking them as recipients of care, but really participants in their own health, with a responsibility but also a right to engage in their own health, to actually take part in co-decision making with health professionals with regard to how to move forward with their health.
How is ESR-PAG trying to help?
The European Society of Radiology Patient Advisory Group is a relatively new organisation, new structure. We were set up 2 years ago, and we're bringing together patient representatives from different disease areas and professionals from the society and sister societies to sit together to work out how the society and the radiology community can become more patient-centred in their work. So one thing that we're doing with the Quality and Standards and Audit Committee is developing a driver diagram on patient-centredness, and within that, of course, is reference to quality information, how communication and dialogue should happen in practice to ensure the best possible outcome for both patients and radiologists at the end of the day.
What can ESR-PAG learn from this cooperation with ESR to work with other societies?
I think that the commitment that the European Society of Radiology has shown to working with patient groups, setting up the patient advisory group, regular meetings throughout the course of the year, really involving us and consulting us with regard to the Congress, and being able to participate and lead sessions in the Congress is a very good and new development, and I think other societies could certainly learn from that. I think also involving us and working together with us in relation to campaigns like their Safe Imaging campaign is a very, very progressive move, and we're also very happy to engage and work with them on some of our campaigns. An example is the campaign that we ran on the European Parliament elections last year, which has resulted in a core group of very committed MEPs, committed to health on the one hand, but also committed to a patient perspective, and that can only be a good thing.